critical care medicine, and also former teacher, lecturer, and researcher in cardiac critical care, and also founding member of the nursing sections of the World Association for Disaster and Emergency Medicine. And also, she's the author of this very important book, International Disaster Nursing. Now, I'm pleased to tell you that she's very kind to give us this book. Of course, with her personal signature here. Yeah, to our nursing school. Thank you very much, Miss Elaine. Very kind of you. Okay, so please, your session.
Thank you. It's an honor and a pleasure to be here in front of you and sharing with you. And I'm going to try to leave some time at the end so we can make sure we have some time for discussion. You can talk to us so we can learn from you also. That's equally as important as us sharing what we have come to learn about in the world of disaster health. If and when you don't understand me, or if I speak too fast, let me know. I put up this last slide, the one that Marvin ended with, just because I want to emphasize one important thing about it. And remember, we talked about if a few things, if you only take a few things home with you today, we talked about the occurrence of a hazard to an event, to damage, to dysfunction, to an emergency, to a disaster. That's an important logical progression for you to keep in your mind. The other one that's very important were the talk about what we can do to improve our capacities as a society. And my last comment about that is a disaster is a failure. It is a failure of resilience. We have failed our society, our people, and ourselves if we have a disaster. It should not occur. It is not natural. It is very, very unnatural and is a failure. So efforts should be definitely concentrated on keeping a disaster from happening. Much, much more important than all the emphasis we put on, and particularly in the healthcare world that we put on, going in and responding. The hours that we could spend saving victims, saving lives. The time and energy and money put into that preparation of responders would be much more effective up here in preparing us and our communities to improve the resilience so we don't even have a disaster. So I want to talk about two other ways that we need to keep in our mind when we want to look at and talk about disasters intelligently and study them and understand them. We need to have a couple of different ways also or additional ways, I should say, of looking at them besides its progression from a hazard to an event, to a disaster, onto a disaster. That's very one important way, and we call that a framework of looking and talking about disasters. There are two other frameworks that we look at, and the first one is called a longitudinal framework, referring to time, but actually not really referring to absolute time, but referring to the chronology of events over time that occur during any disaster. So it's an important reference point. So it describes a disaster over time and in distinct phases. And then we have another framework in which we look at the society that's affected by a disaster. So we have to keep those other frameworks in our sort of armamentarium, if you will, of reference ways to a disaster. So we're going to talk about the time and the phases, and we're going to talk about the components. This might be a little bit hard to read, but I'll pull it apart so you can understand it. So now we're talking about describing and talking about disasters over time. What are we talking about? We're talking about phases of a disaster. And so we know that the phases include the event, an event that occurs, some damage is sustained, some dysfunction occurs. We know there's a period when relief responses are provided. We know there's a period of recovery. This below it is the same identification of phases, but just indicating there's no one can occur very shortly or one can occur over a longer period. They're not in absolute time. We don't talk about a phase of a disaster as minutes or hours. We talk about it as an event that occurred chronologically or an occurrence. And most of them do overlap. An event occurs and it starts some damage quite quickly, and perhaps the decrease in change in function occurs almost simultaneously with the change in damage. Or maybe it occurs later. We talk about the relief response phase of a disaster, and it may start occurring very early and then continue to occur over a longer period of time, depending upon the extent and nature of the disaster. Likewise, we talk about recovery. We talk about returning a society, community, back to the level it was before the event. And that's recovery, and that usually can go on for a much more extended period of time, and sometimes years and years. The recovery and restoration period will go on. So to make sure we know what we're talking about in terms of defining the words we use, the pre-event phase is just talking about what was the status of your community, your hospital, your situation before the event. We need to know that so we can know what the changes have been, what has happened. Then we talk about the event phase, that period during which the event occurs. We talk about the damage phase, when structural damage or damage to humans occurs during that phase. We talk about the functional damage phase. Now, because of some structural damage, some function is lost. And now it becomes much more threatening to us when we lose essential functions. The relief phase now is that time in which interventions are brought in either locally or outside. And these are directed at limiting additional injuries and deaths and relieving current pain or distress. That's the point. That's the purpose of providing relief aid. And then the recovery in which we are applying interventions, actions to bring back the functioning of the affected society to its pre-event status. That's our goal. We're very used to looking at phases of occurrences because this is what we do with patients. In order for us to, a patient comes in order for us to assess the change that has occurred, we have to take a history first to find out what was their baseline? What were they like before that? Were they paralyzed on one side before they came to the emergency room? What was their baseline status? We look at that. We look at what has changed with that patient now. What's the change in their function? What has occurred? So let's look at a patient that would come in, and we do that with a baseline status. That's their pre-event. An event occurs to that patient that brings them in, and that event, in this case, the example is a clot to the brain. They have a stroke, a clot, a cerebral vascular stroke from an event. The damage happens, though, from that event. The damage is neuronal death. Some ischemia of cerebral ischemia. That's the damage that occurs. In terms of the function for the patient, all the patient knows is, wow, I can't move my right arm or my right leg and I can't speak. So that's what some functional change that has happened to the patient. But it's based on the damage and the event. Let's see if I can go in. So then we go on to the relief phase, or the relief response phase, and for this particular patient, it was treatment. It was treatment with a fibrinolytic treatment to dissolve that blood clot. So that is simply that phase of that patient's condition. And then it's followed by the recovery phase to return that patient back to his pre-event status. We will use rehabilitation, they'll get speech therapy, they will all for the purpose of returning function. And this is just another this type of case where the same thing. So looking at a condition of anything in terms of looking at its phases in the disaster world, it's the same as we use in actually the clinical. So likewise, we can compare that type of evaluation, if you will, of the occurrence of a disaster in the same way. So if a disaster occurs, let's say here's the status of the hospital. Oops, I'm sorry. I'm doing the wrong one, pretty much. Pre-event, hospital is up functioning, doing its normal day-to-day acute care functions. An earthquake occurs, that's the event. The hospital, the tertiary care hospital collapses. Let's say there's also 30% less healthcare providers. The healthcare providers become victims themselves. So we have less staff. We don't have an operating theater that's functional. And let's say we lost about a third of the patient beds. So we still have some function as a hospital, but we have compromised our function severely, and we're able to do much less. So we really have developed needs. And the functional damage means we can't do as much surgery. We have much less staff, so we can care for fewer patients. We have less available beds, so likewise we can care for fewer patients. So at a time when probably more patients are coming in, we can do less because we have lost some function. So then this is followed by a relief response phase. And this could be a number of different things, but perhaps an alternative care site had been set up that the hospital had in their emergency operations plan. Or perhaps a field hospital is set up in the parking lot next to the hospital. Perhaps we have volunteer healthcare providers coming either from another local hospital or from outside. Those responses are the relief phase. How can we minimize the injury and the deaths related to this lack of function? And then that we have a recovery phase now in which the hospital will focus on rebuilding its structure, increasing their personnel, and going back to be able to function the way it was before. And perhaps in rebuilding, they may now even improve improve the quality of the structure. They may now use even better quake-resistant materials. They may rethink the architectural and structure of the building in terms of preventing it. And so when this occurs,